You're welcome. All right, so let's start with, so what I do, and maybe it would be helpful, I don't think I sent this to you yet, so let me send you an email real quick with the information on what I use to observe clinics.
Mhm.
So let me send that to you really quickly. That way you can follow along with what I'm going over. Let's see. Much. Okay, I just sent it to you. And it's just the observation form that I use.
Mhm.
So I think when, I guess I need to understand a little bit too, generally, so when you're doing or hosting these clinics, you're primarily the kind of clinic coordinator and IT person, right? You're hosting it, you're opening it up. So on the pulmonary clinic, you're not really necessarily one of the hub facilitators. Is that correct?
Yes, that's correct.
Okay. So I think what would be great, and that this was something that I mentioned to you right after we met on Saturday, was that it would be great to have Dr. Hasham
Yeah.
actually attend the next ECHO introduction, because I think it would be really helpful for him to understand, hear Dr. Aurora give his presentation and kind of hear, what his ECHO mission and model is. And I think that would kind of clarify some things for Dr. Hashim or Hasham as well. And then I think just to structure your clinic a little bit more as a clinic, and I know it's a little bit different when you only have two people on the phone like Dr. Hasham and Dr. Ali. It's more one-to-one than one-to-many. But I'm just thinking as you start getting more spokes coming and dialing into your clinic, you want to make sure that the structure, the infrastructure of the clinic is already set up. So for you, it would be kind of starting off with an agenda, and any spokes that have, and I'm totally blanking on a case presentation.
Yeah.
So, just listing that you're going to be doing introductions, listing that you're going to do a case presentation and how many case presentation and who is actually doing the case presentation. And then also if there's going to be a didactic. And I know the last time I sat in, I don't know, does Dr. Hisham normally do a didactic?
Yes, when requested.
When requested. Okay, wonderful. So, something to think about too is a lot of clinics will develop a curriculum for like 6 months to a year. So they have their didactic topics ready to go each month. And if you need to request different people to give, the presentation for those didactics, you can do that. And they'll also generally leave like spaces in certain clinics to be open for general topics that might come up that they might be interested, or you might be interested in sharing with these particular spokes that are dialing into your clinic. So I think, that would be really helpful, as well as just having a didactic curriculum kind of thought out, at least maybe 3 to 6 months in advance. Do you think that would be something that would work for your clinic?
I think it will work for some clinics, but for others, we allow a room for doctors, for spokes, to suggest certain topics to be discussed during didactic session. So
Okay.
for
Yeah,
some instance, especially for HCV, for hepatitis C, they have a lot of questions about the new drugs and new generations of medication. So
right.
the didactics are used for this topic.
Okay. So generally, like you were saying, the hepatitis C clinic. So do you just leave that open, and then when it's time for didactics, you talk specifically about, you know, the drug questions that they might have? So there's not like necessarily a presentation, there's just a question and answer time, or is there actual presentation with that as well?
Sometimes it's an open question, and others for like a presentation or sharing like conference materials that happened in one of our session that our facilitator have attended one of conferences that discusses the new generation of hepatitis C treatment, and he shared the material with us.
Okay, all right. So specifically to the pulmonary one that I watched, let me look. So under facilitation, so if you look at the scorecard, it's broken up into facilitator, facilitation team members, then it goes to didactic presenter, then it goes to clinic coordinator and spoke participants, and then it finishes with connectivity and IT staff. So some of the things, one of the recommendations I already gave you was for Dr. Hashim or Hasham to attend the IECHO. Because I'd really like to see the spokes on that particular clinic grow. But my question is, like, who have you reached out to as far as for the pulmonary clinic? Has Dr. Hasham reached out to people in Egypt? Because I know he's US based, is that correct?
No, he didn't. He is a US based, and he didn't reach out to any of the spokes. I simply shared the info that we have an expert in pulmonary diseases to give our session for a number of doctors who are working in a specialized medical center specialized in pulmonary diseases. So they show interest in attending this session and preparing their cases in advance.
Okay, so you're actually the one going out trying to recruit these spokes. Okay, and have you had, how much interest have you had as far as the pulmonary clinic? Are there more people that want to come, just haven't been able to? Or I know you were saying at one point that a lot of people will come and then drop off and then come later again. So
yeah, this happened, and total number are around from 10 spokes.
On the pulmonary clinic?
Yeah.
Okay. Well, I think if you have up to 10 spokes, I think that would be great. And if you could get them to where they're interested in coming every week, and sometimes if there's a didactic presentation, list where they can go out and see what's coming up, that's also a way to create or generate some interest for them to come to a particular clinic. So something to think about. One of the other things, because it was so small with your group, introducing themselves every time is not necessary, but it's a good practice to get into, is just, saying your name before each, because as new people come in, if you're not in the habit or used to doing that, then sometimes people get lost on who's speaking, and so I think that's a good practice. But like I said, your group was so small, I think that was okay not to say it every time. They knew who was talking. This is the other thing that I think is really important, and I know that connectivity issues for you are could be challenging.
Yeah.
But I think it's important to have people on video. So it makes a difference when you can see somebody and have that interaction with them versus everybody being off screen, or having their video shut off. So I would suggest that, especially as more and more people start to join the clinic, that you would encourage them to have their video on. And if they're having trouble with connectivity, one of the things that you can always do is plug in to the internet directly instead of using Wi-Fi to connect to the video. You know, and I don't know if how the internet is over there, how stable it is, and how depending on where you are and where you're joining from, I'm sure it makes a difference. But do you have any thoughts on the connectivity issues or why people don't want to use their videos?
Yeah, I think for connectivity primarily, and also maybe because they are shy. So, for Ali, for example, Dr. Ali, he is that kind of shy person. Maybe at the first, maybe later in other sessions, he would get more prone to show on video.
Right, and I totally understand that, because I don't particularly care looking at myself on video either. But I think it's just very helpful to kind of gain that that personal contact with somebody. Like when I'm sitting here looking at your, Reaching You logo. That's fine, but I connect with you better when I can see your face and when I can see your expression, and it just is more helpful. And of course you can see me moving my hands so you know that I'm into the conversation. But so I just would encourage people, if they can and if their connectivity is okay, to really be seen on video. And I know it's hard, but it's just getting used to kind of having to see yourself up on that screen a little bit. So that would be another recommendation. And I'll send all of this to you in email, Om. Let's see. So I thought Dr. Ali did a really good job of presenting his case. I know it was, I couldn't understand what he was saying, but I definitely thought, in looking at his case presentation form, he gave good information and he had good questions listed at the end, which was very great. Have you looked on Box, Om, to see what case presentation forms we have out there that you might be able to adapt to the different clinics? Okay.
Yes, I had a look on the box, but I prefer to let spokes to write their own kind of, especially for the pilot session, like for pulmonary disease. So it was his own writings that I uploaded or shared during the last session.
Sure. One thing I might suggest that you do is kind of give them an option. Maybe create a blank template of one of the case presentation forms that you like and think might be useful, and just give them the option of using it. If they like it, they can use it. If they don't like it, they can write it up the way they did. But it might be helpful to guide them too on what information is needed. But I thought he did a good job, so I think that was really good. And I think the case, like, it seemed like the case presentation was maybe 5 to 7 minutes long, and then the recommendation by Dr. Hisham was, and I don't know if I understood this correctly, and maybe you can help me with this, Om. But when he was giving recommendations, but then I thought I understood him to also talk through like possibilities of what could happen with this particular patient. Like if other things would happen, he would recommend certain things to take place, or he gave other recommendations based on what could happen. Did I understand that correctly?
Yeah, he did so. He wanted to explore other differential diagnoses that may be in Dr. Ali's mind when he presented the case.
All right. So when the only thing that I worry about is like when you have more spokes on is being able to get to all your case presentations that you might have coming in. So I don't know if he'll adjust that because it was a one-on-one. I think he was just giving a lot of information to Dr. Ali, which I think was great. But I think that's something that Dr. Hisham could also look at and think of maybe using some of those recommendations that he was giving for possible like diagnosis, future diagnosis. He could use that maybe even as a didactic at some point and say, you know, if your patients present with X, Y, and Z, here are some recommendations, and he could, you know, possibly use that as a guide for himself on didactics that he might want to give to share with the spokes.
Yes, you're right. In the other session, the first and second one, we have 3 participants and with 3 case presentation. And Dr. Hisham realized that he has to shorten his speech or his reflection on the cases.
Okay, wonderful. So I think that's primarily, and let me see if I'm in my notes I had anything else. Oh, you know, something else I wanted to suggest to you, Omen, I don't know, you have a logo from us, right? You have an ECHO logo?
ECHO logo? No, you mean the one presented in each document?
So, like, I should have, I thought I sent you, and if I didn't, I apologize for that. But you know how we have this logo in the back right here?
Yeah. Mm-hmm.
So I should have sent you a little template for you to make your own ECHO logo, and it should say Reaching You Egypt on the bottom. Do you have that for me?
No, I don't think so. No.
Okay. I will go out and look, and I'll send it to you. And I just think it would be great to have your logo, you know, the ECHO logo up along with your Reaching You logo. Even on, I don't know how you put your logo up on your video, but I think for people to start seeing that and getting used to knowing that this is an ECHO project, even for your spokes, would be helpful too. I mean, you don't have to, we don't, you know, make it mandatory or anything, but if you do want to use it, I'll send it to you so you have that as well.
Mm-hmm.
And then, let's see. Oh, the other thing, do you do, so in this situation where Dr. Ali was presenting this case, and there were a lot of, it seemed like this could probably be a follow-up case that he could present later. Do you track that and kind of keep track of any cases that might be follow-ups? Because that's something you can track in iECHO, just so you know.
Yes, he is supposed to call me tomorrow to give me a feedback about the case.
Awesome, great. And then, do you have any questions for me, Om?
For this session, no, it's...
Okay. Okay, I think I covered almost everything. Was that helpful for you to talk through that?
Yes, very helpful. We would explore the didactic much more than we usually do.
Okay. And like I said, I would just recommend, you know, having an agenda because it's just helpful for people to see, you know, what the clinic's going to look like. Okay. And also little things like, you know, reminding them not to use personal health information on the patients. You know, reminding them about the chat function, which they used really great, I think, in your clinic. So I don't think that's an issue. And then, is Dr. Hisham going to be the only one kind of leading this pulmonary clinic, or is he ever going to have other clinicians in with him?
For pulmonary disease, no, he is the only one.
He's the only one. Okay. All right. Well, I will finish. I have most of it typed up for you, and I'll finish typing this up and send this out to you. But if you have any questions on it, let me know, and I will also send you your logo as well. But I'd love to sit in on one of your other clinics as well and just help you any way I can, you know, to continue your movement in Egypt. I'm really excited for what you're doing over there. Oh, and then the other question, did you ever get in touch with that other group in California by chance?
I tried to. I actually sent an email to Dr. Hassanin and Dr. Fatma. I didn't get any response.
You didn't?
So I'm not sure if I have the right email or maybe they didn't catch it. I don't know.
Yeah, it might be a little, I don't know. I'll try and reach out to them as well and see if I can get any response from them. I haven't heard back from them either since they've been here. And I had sent a follow-up email, but I haven't gotten a response from them. So I will try sending out another one and seeing if he'll respond or if Fatima will respond.
Yes, so. Thank you.
Okay. All right. Oh. Well, just let me know what you need next, and like I said, I'll send this out to you along with your logo, and then we'll go from there, and we'll set up, maybe we can set up another meeting in a couple weeks.
Maybe Thursday better than Friday. So.
Okay. Yes, I can do. Usually Thursdays are good for me, and I totally missed your email to set that up yesterday.
Oh, it's fine for now, but let it be better in Thursday. It would be like the second week of June, right?
That sounds good. Yeah, I'll set up a meeting. Is this time good for you?
Yeah, it's fine.
Okay. All right. I will set up a follow-up meeting then for the June 9th.
Okay, fine.
All right. Wonderful. It was good to talk to you, Om.
Yeah, good to meet you today, Christina and Maris. Thank you.
Nice to meet you.
Nice to meet you.
Have a good day.
You too. Bye-bye.